start by defining the problem that has convicted so many of us at Table Health to step out, take some risks, and really try to make a difference. The reality is we live in a culture that supports the booming economy of unhealthy living, eating, and a culture that demands too much from people in the workplace and often in the home. Our children are just as busy. They are constantly bombarded with crafty marketing aimed at keeping this chronic disease economy going strong. So we live in a nation filled with broken people who have endured childhood trauma and are now experiencing the toll that it has taken on their health. And these are the parents that are raising our next generation. This, to me, is not a medical problem. Yet we have built an expensive, disease-focused healthcare system aimed at treating symptoms, but never aimed at really actually stopping this vicious cycle at its source. So 75% of our trillion-dollar healthcare system is spent on preventable chronic diseases. 3% is spent on prevention. So I don't think the burden to solve our current healthcare spending crisis should be placed entirely on physicians, pharmaceutical companies, and those third-party payers. But instead, I feel like it should be upon us a little bit more than it is. We need to learn how to live better, and I wore the t-shirt to represent. So I think we also need to know how to live better and then make those tough choices. So, although many here have made amazing progress, in fact, I've got some heroes like Josh and Logan and Naomi and Anand. I feel like they have done amazing things, as well as a lot of you in this room. But I feel like we still need more work to make this truly a systems-based approach to health that is practical for everyday people. We need a more unified, coordinated, and that is designed to fix rather than just to pacify. So who are we? Let me first explain what Table Health is not. We are not here with all of the answers to be independent heroes of our broken system. We are not a new primary care office competing for patients. And we are not an alternative woo-woo practice. We've heard all those things. We are here to come alongside already established systems, motivated individuals, healthcare providers, businesses, farmers, chefs, and families. We are evidence-based, practical in our approach, and balanced. We have tremendous expert human resources and a team of people who are passionate, humble, and very ready to collaborate. Our physician, Jennifer Lyon, who is also a speaker at this conference, leads our team of experts who specialize in mental health, movement, and nutrition, and also health coaching. Dr. Lyon has a consultative practice at Table Health. She focuses on root cause medicine. She maintains her primary care practice that is separate at Brookside Family Medicine. So what do we have right now? We feel like we've only begun to scratch the surface. So Table Health is a functional or root cause medicine collective, helping motivated people transform their health. We offer customized programs for individuals, families, and companies. And first and foremost, we listen deeply to people's stories to get to the true source of the problem. We incorporate medicine, nutrition, movement, and mental wellness as needed based on each individual's story. And then coaching becomes a huge part of this process. We have seen amazing things happen when people are given the encouragement and support needed to change jobs. That's often the root cause of people's stress, to restructure their living space and how they spend their time. We spend a lot of time with trial and error because that is what it takes to find realistic solutions that last long term. There are no shortcuts and there's no factory-like mentality at Table Health. We have 3 membership options available for individuals, and our lab that we have on site is direct pay, providing low cost and expanded labs for those who pay out of pocket or have high deductibles. We invite businesses to ask about our services that can be designed to fit any budget. I'm speaking faster because it's time to wrap up. I know. We have a kitchen, a movement studio, a clinic, and a lab. We also have multiple group classes, workshops, and retreats. We're also willing to travel to you. Our space is affordable to rent for your own events as well. So we have a market, and that whole purpose is to be an example of responsible consumerism, provides local source for lifestyle products that are better for you and the planet. We are working on a sponsorship program and other ways to make our services widespread and accessible. And if we want it to be, if you are the person who's ready to dig in, become the healthiest version of yourself, with our help and a lot of time, you can absolutely do it. So we want everybody to have that access. So to be completely honest, opening Table Health has been a personal and professional just challenge and roller coaster for a lot of us. And it continues to be a bit scary and sometimes overwhelming. We've made both mistakes and really good choices. We are making progress, and now we want to be more closely involved in what you all are doing. How can we join you to define the source of health-related challenges in your body, in your workplace, in your team, your community, and then integrate practical solutions? And how can we join you to be cooperatively engaged in creating a community that supports health at every turn? So, see what we're all about on tablehealthtc.com.